Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq. We cover financial literacy all the time on Trade Talks, but for this segment, we're joined by Cruz, co-founder and Chief Strategy Officer at GoHealth, to discuss improving healthcare and Medicare literacy. Brandon, it's great to have you with us. Welcome to Trade Talks.
Thanks, good to be here.
And, we really appreciate you coming on to address a topic that intersects really at the matter of life and death, because at the end of the day, you need to be an advocate for yourself and your family. And an Institute of Medicine report states that nearly half of all adult U.S. citizens struggle to understand basic health information. Why is health literacy so important, and how does it affect overall health outcomes?
Well, because you need to have access to the information and have the literacy to be able to make the right decisions for your health. Lack of information or literacy leads people to making, and a lot of times, no decision or bad decisions that either cost them their health or cost them money.
What can be done to help improve health or Medicare literacy?
Well, we started the company almost 20 years ago to help people get access to high quality healthcare. And if you use a company like GoHealth, you can get in touch with an agent that has been trained extensively in the specific product that's right for you. And so we'll do something like, ask you a set of questions and put you through a needs analysis to help figure out what plan is best for you and what's going to be best for your health going forward. Once you have that plan and know what doctor you have, the medications you're taking, we can really help make the process more transparent for you.
How is COVID-19 reshaping Medicare coverage and enrollment?
Prior to COVID, about half of people would meet face-to-face and talk to a consultant like this, at their kitchen table or in an office. And because of COVID-19, obviously, we're having conversations like you and I are right now over the internet. And so it's changing dramatically. I think more and more people are comfortable talking over the phone or even over video and getting their information and making their decision on that healthcare purchase.
The recent GoHealth biannual Medicare 2020 report examined Americans' concerns, behaviors, and response to Medicare. Tell me about some of the key findings and what may have surprised you.
Well, I think some of the key findings, and I don't know that this was overwhelmingly surprising. Lots of people are making decisions just based on the premium that they pay and what's coming out of their pocket at that time. We help people understand what it's going to cost, total cost of ownership of that plan, when you do go to the doctor and utilize the healthcare. So one finding was people just tend to pick the lowest price plan when they see it. So that was probably the number one finding that we determined. Okay, so one was cost. Two is literacy. 47% of people actually are overwhelmed when they look at the plans they have. They say that they really need help because they just can't digest it and understand it on their own. Another big finding was virtual care. There's a significant amount of interest in virtual care, but there's barriers to adoption for telemedicine and things like that. So that's growing, and that will continue to grow for a long time. And then I mentioned the COVID-19. The pandemic made it harder for people to receive the care they needed. In the beginning, especially, they weren't going to the doctor when they needed to and skipping visits. And they found it just generally challenging to get medical care during the COVID-19 pandemic. I think that's easing a little bit and people are getting more comfortable, but at the time, that was a big concern.
Right. Well, Brandon, just to add on there, of course, the less time that you spend on preventative or wellness visits, in the end, as you mentioned earlier, it can become more costly to treat those diseases. And sometimes you might not have enough time to do so if you wait longer. So I want to help me understand where GoHealth sits within this ecosystem. Are you part of an insurance company offering? Is it through Medicare? How do you fit into the ecosystem?
So our mission is to give consumers access to quality healthcare. And so that starts with the plan that you purchase. You need to make sure that your doctor's in the network. You need to make sure that the medications are covered. And we help you. We put you through, like I said, an entire needs analysis and ask you a series of questions that will help evaluate what the total cost of ownership for both your pocketbook and your health is going to be on a certain plan. And then once you get that plan, we take it a step further. We have a platform called Encompass that helps you make sure you're going to the right doctor. And we do health risk assessments and things to help you continue to take better control of your healthcare.
All right, Brandon, appreciate the insight. Thanks for joining us on Trade Talks.
Thank you.
You got it. And thanks for joining me. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.